Welcome to another video of Health Facts with Dr. Danesh. In this video, we're going to assess the effects of anabolic steroids on human body. Anabolic steroid abuse in athletes has been associated with a wide range of adverse conditions, including hypogonadism, which means low or absent hormone secretions from gonads, including testes and ovaries, or testicular atrophy, which means smaller testes, which is not functional, impaired spermatogenesis, which means lower production of sperms, gynecomastia, which means the bigger size of the breasts in male, and psychiatric disturbances, which means the mental disorders. But what effect does steroid abuse have on the cardiovascular system? That's what we're going to find out here. Anabolic androgenic steroids such as oxandrolone and decagerabline and equipoise are widely abused for enhancing muscle mass, strength, growth, and improving athletic performance. In this article that published in 2012, they assessed the adverse cardiovascular effects of anabolic steroids, and they showed the pathophysiology imaging. So they've done extensive research to find out the adverse effect of anabolic steroids on healthy individuals who are willing to enhance muscle mass and strength and growth. The term anabolic androgenic steroids refers to a group of compounds that are structurally related to testosterone and exert two main physiological effects, including muscle growth and masculinization. Since 1940s, AAS, which is anabolic androgenic steroids therapy, has been advocated as substitution therapy of testosterone deficiency and hypogonadism, which we talked about. Moreover, AAS in high doses has been abused with the purpose to enhance muscle mass and improve athletic performance. AAS administration has been shown to be associated with cardiovascular side effects or a genital problem, that is gynecomastia, impotency, which means low sex drive, hepatotoxicity, which means toxicity for liver, hepatocellular carcinoma, which means the cancer of the liver, and neuropsychiatric disorder, which means mental disorder as mentioned before, that is aggressiveness and depression. Cardiovascular adverse effects of AAS abuse have been reported sporadically as case reports of hypertension, myocardial infarction, and stroke, dysrhythmia, cardiomyopathy, and sudden cardiac death. So in 2012, next to relevant clinical indications of AAS, which is an anabolic androgenic steroid, in physiological doses, which is 28 to 56 milligram per week, illegal abuse of high doses of AAS as a muscle strengthening agent in eugonadal men, which means men who have no issue with the producing or secreting the testosterone from their testicles, is reported in high rates, which results in blood levels of androgenic compounds 10 to 100 times above the physiologic and therapeutic range. So what are these adverse effects of anabolic steroids on heart and vessel system, which is cardiovascular system? Metabolic and vascular effects of anabolic androgenic steroids. Lipid profile alteration and early atherogenesis, which means plaques in our vascular system or vessels that increase the chance of stroke. Second mechanism that anabolic androgenic steroids affects our cardiovascular system is increasing the adhesion molecules expression and platelet aggregation, which basically means that actually they are increasing the adhesion of platelets, which basically increase the chance of blood clotting. Another impact of anabolic androgenic steroids are impaired vasodilation. Although endogenous testosterone has been shown to exert vasodilatory effects, which means opening up the vessels, AAS, on the other hand, used in hypogonadal men, has been shown to result in paradoxical pro-atherogenic, which increase the blood clotting, vasoconstrictive effects, which means narrowing down the vessels. In summary, metabolic and vascular adverse effects of AAS abuse can be classified as: number one, alteration in the lipid profile, especially decreased serum HDL levels, contributing to endothelial damage. Number two, increased platelets adhesions to vascular wall. Number three, vasospastic effects and impaired vasodilation, which basically means that our vessels are not able to open up properly. This is a case of 40-year-old male bodybuilder with mild abdominal aortic atherosclerosis on CT. So atherosclerosis is the precursor for myocardial infarction. And actually in this picture, as you can see, this is the arrow. This arrow is actually showing that there is an inferolateral infarction owing to acute right coronary artery occlusion, which is caused by AAS, which is anabolic androgenic steroids. However, up until 2012, we didn't have a proper randomized controlled trial or any studies that we could actually rely on until this study that is published in the American Heart Association Journal Circulation. And this study actually looked at the effects of long-term steroid use on the heart. So anabolic steroids are synthetic substances derived from the male hormone testosterone that increase muscle size and strength. In this study, they actually studied on 140 male weightlifters. This study published in July 7, 2017. It is interesting that they actually estimated 2.9 to 4 million Americans that have taken steroids without a prescription to boost athletic performance or appearance. In this study, the longer men reported taking steroids, the worse their arteries were. Plaque buildup is a sign of heart disease, which is the #1 killer of men and women in the United States. I hope you enjoyed this video, and if you like this video, please share and subscribe to the channel for more video to come. And as always, stay happy and healthy. Thanks and have a great day.